My name is Kimberley, and when I was 24, I was diagnosed with a rare inherited bleeding disorder called dysfibrinogenemia. With dysfibrinogenemia, the protein in the blood called fibrinogen doesn't work properly, and this results in an increased risk of bleeding. I was quite surprised by the diagnosis because there was no known previous family history of the condition. And when I was working as a nurse in Leicester, I had taken on well and was admitted to hospital. And blood tests were carried out and it showed abnormalities with my clotting, which then prompted referral to haematology for further investigation. Prior to my diagnosis, I had been through high-risk procedures such as having my tonsils removed with no known bleeding complications. But if I was to cut my finger, it would take some time for the bleeding to stop. Looking back at my childhood, it was clear that there was symptoms of a bleeding disorder there, such as heavy menstrual bleeding, anemia, easy bruising, and nosebleeds. But due to limited awareness of the condition by health professionals, my condition remained undiagnosed. Family planning was an anxious time because of the greater risk of bleeding during pregnancy, labour, and delivery. Prior to becoming pregnant, I attended a preconceptual counselling clinic with the obstetrician, and this really empowered me to make informed decisions about family planning. I had access to accurate and clear information regarding the risk of passing on my condition to a child, and I also had information given to me about how pregnancy, labour and delivery would be managed to reduce the bleeding risk. It was also a really good opportunity to be able to raise any concerns I had and to ask questions about the benefits and risks of treatment that was being suggested, what were the alternatives to the treatment being suggested, and what would happen if I didn't want to uptake the treatments being suggested. As a patient, it can be quite overwhelming attending hospital appointments. There's so much information to take in and the appointment times can seem so short. What really helped me for going to the clinic was thinking of questions I wanted to ask before going and writing down a list. And it helped me to, navigate my way through the appointment. During my pregnancy, midwives were not sure of how to manage my bleeding disorder. And I was prescribed a medication that I was not sure about taking, but seeking a second opinion from my specialist provided peace of mind. It also reduced the risks of harm, and appropriate effective treatment was provided. During pregnancy, you spend a lot of time speaking to health professionals and explaining your condition over and over again. And I was worried about not being able to self-advocate for myself because I was having a caesarean section under general anaesthetic. My haematologist created a pregnancy care plan, which all professionals involved in my care could access. And this explained, what my bleeding disorder was and how it was to be managed. And this ensured safe, effective care. Despite having a high-risk pregnancy, due to effective medical care and management, I delivered a healthy, feisty baby girl with no complications. I had asked for testing at birth for dysfibrinogenemia, but I was advised that there was no testing available at birth to be carried out. My daughter started to show signs of dysfibrinogenemia as she developed through her milestones, such as crawling. When she was 1 year old, she had a head injury, which resulted in us going to accident and emergency. And I decided to ask again for testing to be done because bleeding disorders can be life-threatening and require immediate attention. And by not asking again for testing, it risked Eleanor not getting the appropriate care and treatment, and I had to advocate for her. Testing was carried out in A&E on this occasion, and it was confirmed she had dysfibrinogenemia. And despite knowing there was the risk she had it, still receiving that diagnosis for your child, sort of the feelings of guilt sort of flooded me, and I was worried about the challenges that she would face. But the real positive was I had knowledge of the condition, so I knew I could help her overcome her challenges. She wasn't alone because she had me, and I could say, it's okay, mummy has this too. And we also have a teddy whose name is Bubbles, and she has dysfibrinogenemia too. And Bubbles accompanies us to hospital, and she provides lots of cuddles, to Eleanor if she's feeling overwhelmed in the hospital or she's upset, getting tests done. And Bubbles has the exact same tests that Eleanor has and all the exact same examinations and receives a sticker for being brave too. And this, having Bubbles there, has really created a more positive experience of going to hospital for Eleanor and, reducing her feelings of anxiety. It can be really difficult being diagnosed and living with a rare condition, but it's really important to remember to not be afraid to ask for help or ask questions, because you've got so many challenges sort of to deal with. And I have found accessing patient support organisations is such a lifeline because they provide valuable practical support and emotional support.